High blood pressure, also known as hypertension, is a serious medical condition that affects millions of people worldwide. It occurs when the force of blood pushing against the artery walls is too high, putting extra strain on the heart. Over time, uncontrolled high blood pressure can lead to heart disease, stroke, kidney failure, and other health problems. The good news is high blood pressure can often be prevented and treated naturally with lifestyle changes like diet, exercise, and stress management. One of the easiest ways to help lower blood pressure is by consuming certain healing herbs and teas. Many herbs have vasodilating, diuretic, antioxidant, and anti-inflammatory effects that can relax blood vessels, reduce fluid retention, and protect the cardiovascular system. In this video, we will cover 10 amazing herbal teas that have been traditionally used and scientifically studied to help reduce high blood pressure. These natural remedies are generally safe and cause minimal side effects when consumed in moderation. Drinking a few cups of these blood pressure-lowering teas per day can significantly lower your readings and reduce your risk of hypertension complications. Number 1. Lemongrass Tea. Lemongrass is a tropical grass that has long been used in Asian cuisine for its bright, citrusy flavor. But this aromatic herb also provides potent medicinal effects that can help lower high blood pressure. Lemongrass contains antioxidants like flavonoids, phenols, and vitamin C that reduce inflammation and neutralize free radicals that damage blood vessels. It also includes minerals like magnesium, potassium, zinc, and copper that help relax blood vessel walls. Lemongrass tea's main blood pressure-lowering mechanism is dilating narrowed arteries and vessels so blood can flow more freely. This causes an immediate yet temporary drop in blood pressure. Brazilian researchers found participants who drank lemongrass tea daily for a month experienced significant reductions in both systolic and diastolic readings. Lemongrass tea has a light, refreshing flavor that is enjoyable both hot and chilled. Its ability to dilate blood vessels provides fast-acting relief from hypertension. Drink 1 to 2 cups daily. Just be sure to avoid excessive consumption as lemongrass can interact with certain medications. 2. Hibiscus tea. Known as sour tea in Iran, vibrantly colored hibiscus tea is made from the calyces or dried flowers of the Hibiscus sabdarifa plant. Studies show hibiscus contains powerful anti-hypertensive properties that can help treat high blood pressure and maintain healthy blood vessel function. Research reveals hibiscus tea acts as a natural angiotensin-converting enzyme, ACE, inhibitor. ACE inhibitors prevent an enzyme in the body from narrowing blood vessels and raising blood pressure. A study in Nigeria had 65 people with mild hypertension drink hibiscus tea or a placebo. After 6 weeks, the hibiscus group had an average blood pressure reduction of 13.2% systolic and 10.7% diastolic. Drink 2 to 3 cups daily for the antihypertensive effects. Hibiscus tea has a tart, cranberry-like flavor. Its powerful blood pressure-lowering properties make it a valuable addition to your morning routine. 3. Green tea. As one of the world's most popular teas, green tea is renowned for its many health-promoting properties. The polyphenols in green tea, called catechins, are antioxidants that protect the cardiovascular system on multiple levels. Green tea improves blood vessel flexibility, lowers cholesterol, and prevents plaque formation in the arteries. Green tea is especially beneficial for lowering high blood pressure. The catechins stimulate production of nitric oxide, a compound that relaxes smooth muscle in blood vessel walls. This causes vasodilation or widening of the arteries, so there's less pressure on them. Research shows regular green tea consumption significantly reduces hypertension risk and helps maintain healthy blood pressure levels. Drink 2-3 cups per day for maximum cardiovascular benefits. Flavorful and energizing, green tea is one of the simplest ways to keep your blood pressure levels optimal. Its catechins provide antioxidant, anti-inflammatory, and blood-thinning effects that protect heart health on every level. 4. Hawthorn Tea. Used in traditional medicine for centuries, hawthorn is a flowering shrub rich in antioxidants called oligomeric procyanidins and quercetin. Hawthorn tea has been shown to improve circulation, prevent plaque buildup in arteries, and boost heart function. Research indicates hawthorn is highly effective at lowering blood pressure by relaxing and dilating blood vessels. A study had 36 people with mildly elevated blood pressure take 1,200 milligrams hawthorn extract or a placebo daily. After 10 weeks, the hawthorn group reduced both their systolic and diastolic blood pressure significantly more than placebo. With its pleasantly mild, earthy taste, hawthorn tea is best consumed in the morning when blood pressure tends to be higher. Its antioxidant flavonoids promote healthy circulation by relaxing constricted blood vessels. 5. Chamomile tea. Soothing chamomile tea has long been used for its sedative and anti-anxiety effects, but chamomile also provides significant cardiovascular benefits that can lower blood pressure. It contains apigenin, a flavonoid antioxidant that reduces inflammation and helps dilate blood vessels. A study had 64 diabetic patients drink chamomile tea 3 times per day for 8 weeks. The chamomile group saw notable improvements in blood pressure, cholesterol, and triglycerides compared to placebo. Researchers attributed this to chamomile's flavonoids, which act directly on blood vessels and protect them from free radical damage. Chamomile tea can be enjoyed 2 to 3 times daily, especially before bed for its relaxing, sleep-promoting effects. Chamomile helps manage hypertension by lowering anxiety, improving vascular health, and thinning the blood. Its delicate floral flavor and aroma make it a soothing beverage any time of day. 6. Black tea. As green tea's oxidized counterpart, black tea retains many of the same heart-healthy plant compounds, like flavonoids, tannins, and theaflavins. These antioxidants improve blood vessel flexibility and lower inflammation and cholesterol. Researchers found regular black tea consumption can significantly reduce the risk of developing hypertension. A meta-analysis concluded those who drank 2 to 3 cups of black tea daily had lower systolic and diastolic blood pressure compared to non-tea drinkers. Black tea's anti-hypertensive effects are likely due to flavonoids that increase nitric oxide production, allowing blood vessels to dilate. The rich, brisk flavor of black tea pairs well with morning and afternoon snacks. Drink it daily to keep your blood pressure in check and obtain other cardiovascular benefits. Number 7. Oolong Tea. Oolong lies between green and black tea in terms of oxidation. It provides active compounds from both teas to create a delicious, health-promoting beverage. Oolong's polyphenols called theaflavins relax blood vessels and increase circulation. Research reveals those who regularly drink oolong tea have lower blood pressure. One study had 1,200 people drink various teas for a year. The oolong tea group's mean arterial pressure decreased by 3.23 mmHg. These results indicate oolong's consumption can reduce the risk of developing hypertension. Drink freshly brewed oolong tea 2 to 3 times per day to obtain its antihypertensive effects. Oolong's aromatic, fruity flavor is ideal anytime you need an energizing pick-me-up. 8. Rosemary tea. Rosemary is a fragrant herb popular for its culinary uses. But rosemary also makes a healing tea that can lower blood pressure and prevent heart disease. Its active ingredient, rosmarinic acid, is a potent antioxidant that prevents LDL cholesterol oxidation. This lowers plaque buildup in arteries and allows them to relax. Studies confirm rosemary tea's antihypertensive effects. A clinical trial had people newly diagnosed with stage 1 hypertension drink rosemary tea for 6 weeks. The results showed rosemary tea significantly decreased systolic and diastolic blood pressure compared to baseline. Researchers concluded rosemary tea can be an effective herbal treatment for hypertension. Rosemary tea has an evergreen, aromatic flavor. Drink it regularly to control hypertension and obtain rosemary's other benefits like enhanced memory and digestion. Number 9. Dandelion tea. Don't overlook the medicinal effects of the unassuming dandelion weed. Dandelion tea acts as a natural diuretic that increases urine output to lower blood pressure. The high potassium content replaces potassium lost through increased urination, helping normalize blood pressure. Research shows dandelion tea increases glomerular filtration rates and inhibits renin activity. This natural diuretic effect provides antihypertensive benefits without the side effects of pharmaceuticals. A study found patients taking dandelion tea twice daily for a year saw their systolic blood pressure drop significantly. 10. Cinnamon tea. Drinking cinnamon tea is an easy, flavorful way to lower your blood pressure. Cinnamon contains antioxidants called polyphenols that reduce inflammation and protect your cardiovascular system. It also improves insulin sensitivity, lowers LDL cholesterol, and reduces high triglycerides. Studies confirm cinnamon's ability to reduce blood pressure, especially in those with prediabetes and diabetes. The antioxidants in cinnamon increase nitric oxide levels, which relaxes blood vessels and improves circulation. Drinking cinnamon tea may also stimulate circulation by warming your body temperature. Cinnamon tea has a delicious spicy sweet flavor perfect for drinking before bed or after meals. Its warming properties and antioxidants make it an excellent addition to your anti-hypertension diet. Drinking herbal teas is an easy, effective, all-natural way to lower high blood pressure without using medications. Many delicious teas contain active ingredients like polyphenols, antioxidants, and minerals that can reduce blood vessel restriction and inflammation. This leads to improved circulation, lower cholesterol and plaque buildup, and normalized blood pressure readings. Making teas from herbs like lemongrass, hibiscus, green tea, black tea, cinnamon, and more provides the compounds necessary to prevent and treat hypertension. Research confirms the regular consumption of these teas can decrease systolic and diastolic blood pressure in those with prehypertension or mild hypertension. Herbal teas offer a safe method to control blood pressure with minimal side effects. Used alongside dietary changes, exercise, and stress management techniques, these powerful teas support heart health and reduce your risk of associated diseases. It's best to slowly introduce herbal teas into your routine and be aware of possible interactions with medications you're taking. Monitor your blood pressure and notice any symptoms like dizziness, lightheadedness, or racing heart. Consult your doctor to determine your target healthy blood pressure range. Drinking delicious herbal teas is an easy way to incorporate more plant compounds and antioxidants into your diet. Pick several to rotate and discover your new favorites that specifically target high blood pressure. Steady consumption of these amazing brews will help regulate your blood pressure for lifelong cardiovascular wellness. Thanks for watching this educational video on amazing herbal teas that can lower your blood pressure naturally. I hope you discovered some new teas to try that will become a healthy daily habit. Controlling hypertension is critical to protect against associated health risks like heart attack, stroke, dementia, and kidney disease. Lifestyle measures like maintaining a healthy diet, staying active, reducing stress, and limiting alcohol are fundamental. Adding in these medicinal teas provides extra blood pressure lowering benefits for a well-rounded treatment approach. Be sure to monitor your blood pressure to determine if it's remaining within a healthy range. You may need to modify your medications if drinking tea causes it to drop too low. Checking your readings in the morning and evening will provide you with helpful data to discuss with your doctor. I encourage you to do further research on herbal teas, brewing methods, and their interactions with any prescriptions you take. It's wise to consult your physician before making any major changes to your treatment regimen. Thank you for watching today's video on these 10 amazing herbal teas that can lower your high blood pressure. I hope some of them become your new favorites that you look forward to drinking daily for improved cardiovascular wellness. Please like this video if you found it helpful, and be sure to subscribe to our channel. Thanks for watching, and we'll see you in the next video.